But the classes, it's been a while since I've been in school. So
yeah, you just like hurt my head with SPS. But yes, okay, wonderful. Hello, and welcome so much tonight to to this evening's discussion, identifying and dismantling systemic barriers in healthcare, where we hope to have an honest and frank conversation regarding race, ethnicity, racism, inequality, and as well as opportunities for improvement in the healthcare culture and system. My name is Swapna Reddy, and I'm a clinical assistant professor at Arizona State University's College of Health Solutions. I teach at the undergraduate and graduate levels, specifically in health policy and health disparities. And I also teach at Mayo Clinic Alex School of Medicine. Before we get started with our conversation today, I'd like to first take a moment to recognize the land that we're on. We do this before every gathering we host to ground ourselves and reconnect with those around us. It's important for us to save space for those who are not only with us today, but also for those who are with us today, but also for those that could not join us today, and for those who came before us. In particular, we'll acknowledge the land that ASU's campuses reside on today. ASU's campuses are situated on the homelands of many Indigenous peoples, including the Akamur, Otham, and the Peeposh. Many Indigenous peoples. Arizona State University recognizes the original inhabitants of these lands and recognizes that they reside throughout the Phoenix metropolitan area. And we recognize the impact of their wisdom and generosity towards us. So now let's get started. Despite important strides in the past few decades for racial and ethnic minorities and women joining the healthcare industry, there's still glaring gaps in providing a workforce that's frankly reflective of our society. That means from a race perspective, ethnicity perspective, gender perspective, socioeconomic perspective, urban versus rural perspective, lots of sort of different identifiers. The majority of those that practice within the healthcare industry still don't really look like and come from the communities that they serve. For example, the percentage of Black men in medical school is lower today than in 1978. And we'll talk a little bit more about kind of that general experience today. 23% of African Americans, 26% of Hispanics, 39% of Asian Americans have a physician that share the same race or ethnicity as them. While for white Americans, that number is 82%. So disparities in education, salaries, and job stability for minorities tend to be lower educated, lower paying professions in healthcare. So what I mean by that is if many of us walk into a healthcare system or a hospital these days, especially in a place like Phoenix right now, metropolitan Phoenix, you might say, well, this seems actually like a fairly diverse place. There's lots of people walking around that work here and they seem to be a variety of different races and ethnicities and backgrounds. Yet if you kind of take a closer look, what we know is that the vast majority of racial and ethnic minorities reside in those professions that require lower education and that pay lower salaries and certainly offer less job stability as well. And we'll speak a little bit kind of more about that and the culture around that later. Nationally, issues of inequality and racial injustice are in the forefront, as we all know. And I know many of us have been engaging in conversations around racism and inequity and inequality for a long time, but very specifically with a lens towards this conversation, especially in the last few months. Lots of tough conversations. While many of these are really, frankly, nothing new for our country, we do seem to be at sort of an important precipice for honest discussion and hopefully forging a path forward. I would argue that we're doing that at ASU as well. We're having some tough conversations, important conversations, and lots of leadership buy-in at our university and within our colleges as well. As such, it's vital that our university community meets this moment and tackles tough topics of our time. As we discuss systemic inequalities, it's important to note that healthcare is just really, frankly, one of the largest systems in those systemic inequities, right? We talk about systemic issues, systemic challenges, systemic inequalities. Healthcare is one of the largest systems in our country, and has a long history of not only racism, but discrimination, inequality, and not just towards racial and ethnic minorities, but also towards immigrants, also towards women, towards the elderly, kind of a variety of groups. But there's important examples for evolution as well. Today, we'll join a group of ASU and College of Health Solution alumni to discuss their experiences working within the healthcare system and social sciences, and perspectives on diversity in their professions, and also kind of collective goals to create a more just healthcare system. So at that, I'd like to introduce my panelists. First, we have Carletta Miller, who has a BS in the Science of Healthcare Delivery, and she graduated in 2017. I'll tell you a little bit about Carletta. With over 13 years of professional experience, Carletta now works for Dignity Health in their human resources department, ensuring that all employees have access to the resources that they need. She now volunteers as a career mentor through ASU. Carletta also recently completed her 200-hour yoga teacher certification, with plans to launch a nonprofit to bring yoga as a means of mindfulness to Black and Brown communities. So welcome, Carletta. Next, we have Tiara Cash, who has a BS in exercise and wellness from Arizona State University and from the College of Health Solutions. Tiara Cash was formerly at the Center for Mindfulness, Compassion, and Resilience as an alumni of ASU. Her practice of mindfulness spans the last 20 years of her life. And as a practitioner, she's worked in various high education settings, including athletics, campus recreation, and student success. Her career focuses on delving into the intersection of mindfulness in marginalized and unrepresented populations and resilience during life transitions. I want to note that not only does she have the bachelor's in exercise and wellness from ASU, but she also has a master's degree from Western Illinois University in kinesiology. And really exciting, this fall, she's begun her doctoral journey at Simon Fraser University in social psychology. So she's joining us from Canada tonight. And our last panelist is Ashley Franco, who has a BS in nutrition from ASU, College of Health Solutions, and a master's in the science of healthcare delivery. She's a current doctor of pharmacy candidate at Regis University in Denver, where she's currently working clinical rotations. She's an experienced pharmacy professional, research analyst, and auditor in various healthcare sectors. So I want to welcome all three of you to our discussion today. I want to also note it's really lovely because Carletta and Ashley are actually former students of mine. So I don't often get to be on panels with former students. So it's lovely to kind of see that full circle. But I think it's also maybe a little bit reflective of my age at this point. It's like, now I'm at a point where I've been around for a while and now I'm doing panels with my students. So in any case, it's a really lovely experience. I want to go ahead and get started and ask all three of my panelists, when you chose your field of study and practice, did you feel like there were a lot of people that looked like you or that came from your racial and ethnic backgrounds practicing in that field? And did that influence your decision at all?
So I'll get started. Hi, everyone. This is Carletta, and I am in human resources. Dr. Reddy, as it pertains to me feeling as if there were people that looked like me from my racial or ethnic background, I really didn't know a lot of HR African Americans. When I would show up for interviews, I never saw anyone that looked like me. That was a bit of a quandary, just because I wondered, what do we do? Why aren't we a part of the hiring practice when it comes to bringing on employees to better the organization or program that we're participating in? So it did influence my decision because I wanted to be a representation and maybe the first voice that that person hears over the phone to be able to relate to and to consider, okay, this organization may be a good fit for me because they have someone that looks like me and sounds like me.
Yeah, thank you for this question. You know, originally when I got the exercise and wellness degree, I wanted to work with athletes. And fortunately in that field, I had large shoes to fill, even in my own family of people who looked like me. However, as my area of service really changed to a more holistic way of looking at wellness and resilience training, I saw fewer and fewer and fewer people who looked like me and came from my racial and ethnic background. And you know, now as a mindfulness practitioner specifically, it's few and far between, which is one of the reasons why I worked on creating the Equitable Mindfulness Initiative and framework here at ASU and helped to create this position at the center of the culture and equity specialist. Was really because we don't necessarily have representation in the research or the field. However, you know, we have people who have deep experiences related to this work who are BIPOC and people of color. And so I wanted to help create space for those experiences. You know, mindfulness is bigger than just the images that we see on TV. And in my research, most, if not all cultures have a tie to it. So for me, it was really important to really jump out of the box of what, you know, this is supposed to look like and show representation, just like, you know, Carletta said, does matter. And, you know, I wanted to be one of the people who represented that fact.
Hello. So for me, being in a doctor of pharmacy program, especially, you know, on the West Coast, being from Arizona, there definitely was not anyone who I could relate to or look like me. And especially, you know, going after a doctorate degree in general, as Dr. Reddy already mentioned, there's hardly anyone that looks like me. So that definitely was a barrier that I felt like I faced. And also, you know, just to overcome, because, you know, you hear things like maybe you got into this program because you're a minority. And so I definitely think that my decision to be in a doctorate program and to go the full way was because I didn't see anyone that looked like me. My background, I was a pharmacy technician for 10 years before I went to pharmacy school. So all during my undergrad, bachelor's degree and master's. So, you know, I had been in the field a long time and didn't see anyone who I could relate to. And so in my thought process, I wanted to be that person that someone could look at and understand that they took the full leap, and they didn't have to be the person that you said, you know, you might come into the hospital and think that they have the lower paying job. I wanted you to see that the progression could go from, I was a pharmacy technician that you saw walking the halls, and now I am the pharmacist as well.
That's wonderful. Thank you so much. Thanks to all three of you for those thoughtful answers. You know, Marian Wright Edelman from the Children's Defense Fund and happens to also be a former boss of mine famously said, "You can't be what you can't see." And I've always thought that those were such powerful words. They've really stuck with me. And now that I have children myself, and we think about this concept of modeling and role modeling and how important that is, I think those words have taken on sort of a new life for me. How important do you think it is for students and young professionals, young people, to have role models in the health professions that are from similar backgrounds? I mean, do role models really need to per se look like us or come from the communities that we come from, or can kind of role models come from all sort of walks of life? What do you guys think?
I'm going to start this question just because something, you know, awesome happened to me at work. It has happened to me a few times, so I just wanted to share. So I definitely believe that, you know, we do need role models that look like us, especially growing up and as young professionals, because like I mentioned, it gives you the empowerment to see people that look like you go further. And so I currently work at Children's Hospital of Colorado. And as a pharmacy intern, we get to do med reconciliation. And so sometimes we have kids that come in and they need sleep studies. And I had a girl an African-American girl. She had to be 17 or so, and, you know, she wasn't taking her medication. And, you know, I talked to her and I gave her some motivational interviewing about why she really needed to be on this medication for her long-term health. And you could tell that she just felt like she wanted to listen to me. And as a student, you know, that part is great because I'm a student, you know, and I'm like, wow, she's taking my recommendation. But I know it was coming from a place of like, this girl looks like me and she really knows what she's talking about, and maybe I should listen to her. And then other times, you know, I go into a patient's room and I've had kids where their mom will be like, oh, honey, look at her. She looks exactly like you know, you can do that too. And those are the days at work that mean so much to me because, you know, that's why we're here, to empower, you know, our kids and you know, our future healthcare professionals.
Love that. Thank you for sharing that. Carletta or Tiara, did you have any thoughts there, friends?
So I wanted to hone in on what Ashley stated, and I'm sorry, my fur baby is hearing someone at the door in case you hear Deuce. The beautiful piece of where we are today is, albeit that it's few and far between that we have minorities in roles or examples to where we can say to our children, look, they look just like you can be that too. I commend you for that, and way to be there, Ashley, and to be that example. Dr. Reddy, you asked if role models can come, can be present. Do they have to be minorities? And they don't. They can come and in all shades. The reality is, I want to see someone like me, and I want to mentor someone who looks like me. When I'm having conversations in meetings and at organizational functions where I'm looking at a brown-skinned girl, the relatability from the female to female perspective and the minority perspective, both color and gender, there comes a factor of embracing. I'm embracing this person, and they're honing into what I'm saying based upon my experience and sharing my experience, because I can help them, one, potentially go through something that they may encounter, and two, they can avoid some things when it comes to sitting at the table with others. So while those examples can be many shades, it is definitely appreciated to have a person of color and a female that sits in my role that I can reach out to for guidance, advice, and mentorship.
Thank you for that. I couldn't agree more on the two facets of a female and also a female of color, and actually how much that relatability means. I feel that every day, even now. And I wanted to note, as from being in HR for a major healthcare system right now, you're in a really kind of unique role as a gatekeeper for many people in our community to enter the workforce in that healthcare system. So even more important to have more people with your sensibility and background and understanding in that gatekeeper role. Thank you. So Tiara, I wonder what you think of this question.
Yeah, I'll piggyback right off of where Carletta left, because I think I'm gonna take this, you know, kind of in a middle ground from both being a professional and a student. You know, coming here to Canada when I came on my visit, I'm in Vancouver, and there's 2% Black and people of African diaspora backgrounds. So very small relatability when it comes to seeing people who look like you out and about. And I am the only visual person of color in my department. So, which, you know, is not uncommon, honestly, in higher education, if we're being quite honest about it. So when I came in and talked to my supervisor, you know, before deciding where I was going to go, one of the major things that I wanted to make sure I found was someone who looks like me. And, you know, lo and behold, on the wall in the picture of the new people who, you know, new tenured professors, was this beautiful brown skinned woman who is of Indian descent, And I think my supervisor could visually see how I lit up. And I'm like, does she work here? Is she in this department? And she was like, absolutely, she's here, give me some information. And when I met her, it was funny. We had, just like you said, this instinctual level of relationship because we could understand each other as women of color in a place where we are a minority. We knew that, you know, and she even said to me, I'm totally okay with being your token brown person, which was a joke, but also in a serious way. She knew that, you know, I would come to her if I ever had those type of experiences. So I think it's also really important to see people, but to be able to have that outlet as well.
Yeah, it's an excellent point that you make about, you know, frankly, sometimes the exhausting nature of being the only, right? Whether it's the only woman, person of color, you know, ethnic minority, religious minority, whatever that is, it can get exhausting being the only. And then the othering of that experience can weigh very heavy. So just to have somebody else that might experiencing that in some way can often relieve that weight. So thank you so much for sharing that. So I guess, you know, let's think a little bit about bias and sort of just launch right into it and ask you guys, hopefully not too personal of a question, which is, you know, we're talking a lot about bias in our country right now. We're thinking about explicit bias, but we're also thinking, especially in healthcare, about implicit or unconscious bias, right? The biases that we're not even aware that we have, and we all have some, that are coming out in the way that we're treating patients, community members, each other, whatever. And then also this idea of microaggressions, right? And I know that Barrett recently also hosted a conversation about microaggressions. So can you guys speak to your experiences with sort of any and all of these pieces in your education and or in your current practice, that sort of either explicit, implicit, or microaggressions piece, and how that's really impacted you, and how do you deal with it? And you don't have to give every example because I'm guessing all of us have many examples, but if you could speak to that a little bit, I'd appreciate that.
Yeah, I don't mind beginning this conversation. I have, as I'm sure all of the women on this panel have, been a victim of all sorts of bias when it comes to higher education as both a student and a professional who works in higher education, you know, having experienced both explicit and implicit instances of bias and micro and macro aggressions. But I think the worst part of being a person of color, and really specifically a double marginalized minority, right? A woman of color, a Black woman, you know you're experiencing a bias. We know, we can feel it inside of our bones that something is going on here. But there's this tendency for the system of higher education to just allow this gaslighting as a part of daily conversations. And so it just becomes normalized for, you know, you to just experience this without having any real proper way of explaining it or having outlets for it. And I remember in my graduate years, not at ASU, thankfully, a professor basically refused to give me an A just because he didn't believe that someone like me could be as intelligent as the other students in the class. And that was my first real experience of having that sort of explicit bias in higher education. But just the other day, you know, as an expert and a creator of a framework that's supposed to be equitable, I was questioned on my own team on my knowledge on the subject. And I myself hold a position for it. And the majority of people on my team didn't even realize that their dismissal of my education in that subject was because of their own bias. So, right, it goes back to this implicit piece. So bias is rampant, it's experienced on a daily basis. You know, it shouldn't discourage us, however, and I think the small practices of taking deep breaths when we need to recenter, or, you know, I use that to choose the right responses and words to stand up for myself in these sort of situations and stand my ground also when it's important to do so. These big breaths are great, healthy mechanisms to use. So I find my breath on a daily basis and work on that and teaching others to use that as well.
I need to remind myself to find my breath on a regular basis. I'm forgetting about my breath sometimes these days. How about you, Ashley and Carletto? Do you both have anything to say here?
I do. To the flip side of what Tiara is mentioning, I actually had a professor that, as I was sharing an experience where I felt I was experiencing implicit bias, and she's a Caucasian female, her reaction to me is, well, Carletta, you're not like them. So what do you mean I'm not like them? Well, I mean, look at you. And so for the listeners, if you can't see us, I'm fair skinned. I have curly hair, which in the Black community would be considered good hair. And with the white race, it's also considered good hair. So she's like, well, you're not like the other Black people. Well, no, ma'am, I'm African American. So I have to deal with, some of us have to deal with that piece as well, where in the classroom with our white teachers and white peers, and in healthcare in our workplace, I may not be seen as, I'm seen as a safe African American because I'm not extremely dark and I don't have very coarse hair. So having to navigate that piece can be a challenge as well, because then you think, okay, how are they really viewing me? And it's also governed by the conversations that we're having. And I have to take my breath and center myself to understand I need to educate here. It's not okay to say certain things. It's not okay. And so I'll leave that there, Dr. Reddy, but that's just another piece as it pertains to how some view African Americans.
So I thank you for that, and thank you for sharing that. I definitely appreciate that. I can tell you from being Indian American, and I speak a lot about racial disparities, racial inequities, inequalities. I've had my share of people saying, "Well, do you really understand this issue? Because you're not really a minority." And it's kind of like, I'm pretty sure I'm minority, and I can give you lots of examples throughout my life where I was reminded of my minority status, right?
Mm-hmm.
So it's an interesting space. And I think also in healthcare, when you are practicing in healthcare, when you are, kind of on the inside, there's a way that maybe you might feel like a safe space, or that people might feel like it's okay to speak to you as they're referencing maybe low income patients or lower income employees, et cetera. And that puts, I think that puts all of us in a really uncomfortable and unfair position as well.
Mm-hmm.
So thank you for that. So I want to ask that question also to my friend Ashley. Ashley, what are your thoughts there?
Yeah, so I'm going to go off what you said about referencing the low income communities or patients. And I actually get that a lot. And when you said that, it kind of triggered me to, think about that more, because I do get, when we're even in the classroom, if we're talking about, just general health disparities, it's always a sense of like, I personally should understand all of the health disparities that happen to minorities, because I have in some way faced, maybe not having the best home life, or, or something of that nature, which is actually not true. And so it upsets me because, you're assuming just because I'm a minority that I've had some, terrible like home life. And I don't think that is a fair assumption of, of any minority or any person in general. And then going on, in practice when I'm out, and I think about, I responded to a code situation, one of my first weeks on rotation. And, I look around the room and I am the only person of color, like at all in the entire room, patient, doctor, everyone. And so of course, instead of, we're worried about the patient, but everyone's head is like turning to me, looking to see like, what is this girl doing in here? And I'm, drawing up medications out of the code cart like I'm supposed to be, but I can feel people staring at me, and that happens anytime I'm on rounds. And like I go back to what Tiara and Carletta said, we have to make ourselves be seen and noticed and push for that. And that's one thing I really do on my rotations and my clinicals. I say, like, can I go on rounds? Can I make this recommendation? Do you want me to drop all these medications during the code because I'm able? And I want people to see, if you have this implicit bias that maybe, a minority is not as educated, I'm going to, go over these treatment recommendations with you. And so it's a learning process. And, to a fault, sometimes I feel like people may not understand because they haven't been exposed to it. And so I want to be their exposure, and I want them to see, if they didn't think a minority could do this, I'm going to show you otherwise.
I appreciate that. Thank you so much. And you remind me of there was a famous kind of stat news article last year, I believe, where where there was an African American physician at Massachusetts General Hospital, which is a Harvard affiliated hospital, and he noted that unless he goes to the hospital in scrubs, there is an assumption that he is a janitor at the hospital. And unless he has his name badge that has his name MD, there is a regular assumption that he's a janitor and he's part of the janitorial staff, and what that feels like. And that, there's moments when he's very patient with that. And there's moments where it's hard to be patient about it. And I think what you're speaking about is very relatable. It's hard to always be patient and calm. And as Tiara would recommend for us to do, take those breaths, right? So thank you for that. So, this year specifically, and especially in the last few months, have really shown a renewed light on inequity and inequality in our country, with a real focus on the criminal justice system, of course. But as I mentioned, we're talking constantly about systemic inequities, and healthcare is a major system in the U.S., right? And really a new light and new attention paid towards movements like the Black Lives Matter movement, right? Is this something you felt that you openly discuss with either classmates or colleagues? Does it feel like it's comfortable to discuss this topic in the culture that you're in? And what's that experience been like?
I can start this one. With the Black Lives Matter and all the protests going on, I had just started my rotations and I cried a lot. I think I cried every single day for about 3 weeks in the middle of my first rotation, which was in May. And then I had to put on this happy face, and when my preceptor would ask me, how is your day going? I would say, okay, but I would literally, then go cry just because out of sheer frustration, just about whatever was happening in the world. And so, no, I didn't feel comfortable, talking about it because one, as a student, unfortunately, you don't want something to affect your grade, because I'm at the end of my time getting a doctorate. I would never want someone to say I'm talking about something inappropriate at the time. So that hurt because I really wanted to get it off my chest and say, like, I'm just really sad right now. Can I take a moment to myself? And I didn't feel like I could do that. And then beyond that, I've held like several leadership positions in my time in pharmacy school. I was president of an organization and vice president of 2 others all at the same time. And there was silence for a long time, and that really hurt me as well, because I felt like, if I'm holding one of the top leadership positions as a student representing the students, and I'm an African American and a female, and there's no, discussion, it hurt me because I felt like, do you just see me as this person holding this position, or do you really see me for who I am as an African American? So, yeah.
Thank you. And Carletta or Tiara?
Yeah, that I go next because there's actually a couple of questions and a comment in the chat that actually ties into what I was going to say as a part of this answer. And I think it's important to bring it up now so that we can understand why we're using different terms to self-identify. So in regards to using, I want to be explicit why I'm using the word Black. In my work in equity and inclusion, Black is actually a more inclusive way to talk about people from the African diaspora who reside in America. So those who might have heritage from other places that aren't just American, but who consider themselves to be American, right? And of the African diaspora, we use the word Black to include them in this whole inclusive environment. So I consider myself to be Black. However, it's also really important that we self-identify and tell others how we want to be labeled. So my parents don't use that. My parents use African American, but my sister and I use Black. So I just wanted to be explicit about that, before answering the question.
I appreciate that. And it's a question, and as you mentioned, a question in the chat, and we want to, and by the way, I just want to say to the audience, if you do want to throw questions in the chat or the Q&A, please feel free. I'm old and get confused with the chat, but I'm glad that Tiara is there to read it. But thank you for that clarification. That's definitely appreciated. I'm sorry, go ahead.
Yeah, no problem, no problem. And I mean, for this question, I'm with Ashley. It's hard, it's tough. It's so tough to be a person of color specifically and watch these movements, and a Black person and watch these movements. But I feel it in more ways than one. Specifically for myself, it was my duty to have these conversations, no matter how hard they might have been. And a part of this is just because of the nature of my role here at ASU. So I had to literally hold spaces for other students and faculty and staff that might have already had conversations like this. But I also wanted to coat these places in these conversations so that when people come into the space who are new, they already have some sort of understanding of what equity and inclusion might look like here. So it's become a lot easier, I think, with the Black Lives Matter movement happening in May and the continuation and momentum from that. I think these conversations have become a lot more easy and direct. And I think that it also brings a lot more allies into the picture, which has been great, but it doesn't take away from the fatigue that we're feeling as we deal with this, which I think is important to mention. I'm glad that Ashley did.
Thank you. And Carletta, what do you think, friend?
Yes, you asked if this is something that we feel we can openly discuss with classmates or colleagues, and what has the experience felt like. At the height of the Black Lives Matter movement was when it was no longer an option to not discuss Black lives mattering to all. I've had some very challenging conversations with colleagues who would defer to all lives matter. And I've had to get blatant and, being polite and respectful, but putting it into perspective. But like I said, it's no longer an option. I've also, what has that experience felt like was your sub question, and it's felt empowering. It's felt it's felt empowering to the point where now I can let you know how I feel, and it's okay. Whereas prior to, it's kind of a taboo topic where we're not to discuss it, we're to walk in it. It's okay for us to walk in it, but it's not okay for us to share how we're feeling. So it's felt, I felt relieved, but as Tiara mentioned, it is exhausting. And when it's come to my peers, some of them are tired, and I will tell them, I'm gonna keep fighting, and I'm gonna fight for us. I'm gonna fight for you and your children and your children's children. I'm not tired yet. And I'd like to take this time to acknowledge President Crow and his action to list 25 actions to support Black students, faculty, and staff that are listed in this issue's Thrive magazine. So it feels emboldening to know we have a voice, we're standing firm in it, we're being heard, And we need to let our voice continue to be heard.
Yeah, thank you so much. I appreciate that. I think the word exhaustion is coming up a lot in our conversation today, right? So yes, it is empowering, and yes, it is emboldening to see this. We sometimes use the word renewed, but I don't know if renewed is fair, because it feels like a new understanding and a new appreciation. And while it's not a new issue, and these are not new problems, right? But for many people in our society, really thinking about this seems to be kind of new. And sometimes that's difficult to digest as well. I think for people of color, it's like, how have you never thought about this before? But we have to be, again, patient with understanding that everybody's coming to this conversation in a different place, and really be thinking about how do we move forward together, but understanding that it is exhausting, and it is an exhausting process to always be sort of this torchbearer of talking about these issues and equity and constantly pushing it forward. And if I'm being perfectly honest, I would imagine it's extra exhausting for members of the Black community in this country right now, and to figure out how to toe that line. And I think we have to be honest about that as well. Okay, I'm actually now seeing that there are some comments here in the chat. So one of our audience members said, "Thanks, Ms. Cash. That is so true. I'm the same way. I just wanted everyone to self-identify and let the listeners understand the difference for each person. My mom only uses the term African American. However, I use Black for the same reasons you said. Thank you for answering my question." And Tiara already answered, so thank you for that. And so, I guess the next question that I have is sort of a big picture advice question, which is, what advice do you have? Most of those that are tuning in tonight are students. What advice do you have for students that are interested in health professions? And obviously there's so many ways to get involved in healthcare and health professions, that either are racial ethnic minorities themselves or are interested in increasing health equity. What kind of advice would you give about entering this system? And what do you wish you knew when you were a student?
So being a volunteer with Alumni Career Services, here's my unashamed plug. Being a student, connect with Alumni Career Services. There are many professionals with many different backgrounds, races and ethnicities, who can provide guidance and support to you to get you through your college career. Also, when you intern somewhere, when you get your first job, it's great if they have an employee resource group, to have an African American resource group to connect with and find a mentor, which many times we're all open to bring someone in under our wing and guide you and provide that professional support to you. Being at ASU, there is the Black student organizations that you can connect with, and there are alumni that are still affiliated. We are still affiliated with ASU Black student unions and union alumni. So that's another way. And we are on social media, Instagram, Facebook, and Twitter. So I would recommend using those platforms to connect.
Great, thank you. What about you, Ashley or Tiara?
Yeah, I can go ahead. This is a really great question, and I wish we had all the time in the world, right, to have conversations around this. This is the meat, I think, the meat and potatoes. But I just have a couple of things that I would say, especially for those who are looking to be health professionals. The first thing is to desegregate your own space, right? So find others who don't look or have the same experience as you and integrate them into your life. And that way you can have wholehearted conversations when you're talking about what equity and inclusion looks like. You're modeling that and living that as well. Those with different, those who aren't able-bodied, those with different sexual orientation, those, make sure that your space includes all of those different people. But in that same breath, it's very important, just like Carletta just mentioned, to have racial and ethnic minority classmates and mentors and professionals who you can relate to in all of your spaces. You know, when you graduate, go out into the field and be intentional about finding those spaces and those mentors, and make sure that you can have those open conversations about your experiences with them, because that's what's going to help you to really move through, especially with this imposter syndrome that will come. It's just a part of this life, you know, and in this workspace.
Can you describe what you mean by imposter syndrome for anyone who might not be as familiar with that?
Yeah, absolutely. So imposter syndrome is basically feeling like, you know, the accomplishments and values and awards and things that you have gotten in a space you don't deserve. So you show up as a fraud, right? You're afraid of being, you're afraid of being found out, that you don't really know what's going on. And I can tell you, I feel like that all the time. It's actually a really normal thing, especially for those of us who are racial and ethnic minorities, because the system is built for us to feel that way. So, you know, you need people in your corner telling you, you're supposed to be there. You need to be here. And so it's really important to have those people in your life so you don't feel like an imposter. You're not an imposter. I guarantee that. ASU has prepared you, I promise you. So it's super important. And then this part is so interesting to me. So I watched a fantastic talk by Dr. Seaton yesterday. I don't know if anyone else had a chance to watch it, but she's always amazing. But she said, you know, the mere act of washing your hands and wearing a mask right now in the pandemic is an act of anti-racism, because you're lessening the effect of the current virus on socially marginalized populations. And I just thought that was brilliant. I was like, you know what? I never thought about that. So, you know, more of that work is needed. Just a very simple way to promote these acts of equity, you know, telling people, okay, you might not want to wear a mask, but think about all the people that you're helping. You know, this is an act of anti-racism. This is allyship. That might actually make somebody do it. So continue to promote those things as well. And those are my advice.
I love that. And thank you so much for describing the imposter syndrome piece, because I think all of us have felt that at different times and feel that regularly. And I do think that there is an extra weight placed on racial and ethnic minorities, and I would say women as well, in our society, and then also in certain fields and health professions being kind of a great example of that, where it feels like, and either people are explicitly saying this, or it's in the air, you know, it's in everything, that are you here because there was a quota that needed to be met? Are you here because some boxes needed to be checked? Or obviously this is how you got this position, or how you got it over someone else, which only lends to that constant sense of insecurity. And if, you know, if I'm thinking back, I think has been one of the greatest sort of roadblocks in my own professional sort of experience and probably personal experience. So I'm really, really thankful that you brought that up. And I had not heard that language around washing your hands and masking as an act of anti-racism, but I love it. So thank you. I'm going to steal that now. And so Ashley, did you have anything you wanted to share, friend?
Yes. So my advice, you know, to the students, I'll just take mine back to being that ASU student in undergrad and getting a master's. It took me a while. And, you know, as going, you know, just thinking as a minority, I know there's people who thought that I would never finish, or I would never get that bachelor's degree, or I would never get that master's degree. And I wouldn't be, you know, I have a countdown on my computer, but like 100 and something days away from having my doctorate. And so I just encourage you all to push forward and keep going, even when you hear people, you know, doubt you, or, you know, say, oh, you've only gotten this far because of so-and-so reason. Even though you know it's not true, it doesn't matter. You're going to keep going, and you're going to finish what you set out to start, no matter how long it takes you. And just know that the more you continue to push yourself, you will be encouraging and motivating the next person behind you to, as we, started this conversation, to see someone else that looks like you, who can, finish what they set out, finish what they started. And then going along with that, I just, I lost my train of thought, but I just think that it's hard as minorities because we're never thought to be at that finish line. And so I just think that, you always have to keep your eye on the end game, and knowing that you can have that seat at the table. Like Carlotta said, we can make that seat at the table, and, finding those mentors who Tiara and Carlotta both mentioned, look like you. And I wanted to say, you guys can always reach out to me because, like I said, I've gone through, 3 degrees now. And so I'd be more than happy to, to mentor you all and, help you go through it. But it is, you can find those people before you enter the workforce. And if it's something in healthcare, reach out to someone at a hospital or wherever it be that you want to end up. And, if you see someone that sparks your interest or is doing something that you want to do, just send a blind email, because you never know where it'll take you. I've sent those just, in learning experiences, and have gotten positive responses. So don't be afraid to reach out and, take those opportunities that you want, even if you think that, you feel that imposter syndrome and think that it's not for you.
I appreciate it. And thank you so much for offering your own, mentorship and friendship and sort of experience with the students. That's incredibly generous. So we have a question here. Have you noticed any common things that even white people who consider themselves not racist, in quotes, are often ignorant about? And I guess whether that's through your educational experience or professional experience. I don't know if any of you would like to answer that one.
I would say the most common, and the most common topic that white people who consider themselves not racist are often ignorant about would be the topic of white privilege. Knowing and acknowledging white privilege. White people need to educate themselves on white privilege. I think that's where it begins.
Thank you. We could have a really long conversation on just that one statement. Unfortunately, we don't have time for that, but that, I think what you just said is incredibly important, and that, and the opportunity for self-reflection, right? And reflecting on on individuals' privilege, but also, some of the organizations that we work within and promote, what is their role, whether it's historically or currently, in either making things more equitable or actually maintaining an unequal status quo, right? I think all of those honest conversations are really important. Tiara, did you have anything you wanted to add there, friend?
Yeah, I was over here saying bloop bloop because I think on the head with that statement. It encompasses so many different aspects that I think are huge, right? And this savior complex, right? I'll go a little bit further to the white liberals. I'll go just that far and say, I think the savior complex is one thing that I'm fighting against right now. Is like, I don't need your help or your saviorship. I need you to listen to me and understand that we have the tools of how to change this. I just need you to help me implement it, right? And so, that is the biggest thing, is like understanding, like you said, their role in the system, and how still, you have to understand your role is going to change. If the system changes, your role is going to change too. So what does that look like for you, and for everyone else? But yeah, I mean, that was it. That's the
Great, thank you. And it brings me to this question. in a lot of organizations, and especially now, there are very distinct, defined, just in some cases, well-resourced diversity inclusion committees, groups, organizations, efforts, initiatives, whatever you call them. And so many of them, though, continue to be either led or highly populated by people of color. And I wanted to ask you all what your thoughts on that was, especially in healthcare. Like, is that who needs to be leading these organizations? Is that who needs to be populating these committees and these initiatives? Is it the responsibility of people of color to be leading the diversity and inclusion kind of charge in these organizations, however well-meaning, those initiatives are, or should we be pushing for others to be more involved? What are your thoughts there? You're like deep breathing, Tiara, when I ask that question. You're on mute, I think, friend.
Yeah.
Everybody's deep breathing.
Yeah. It is not the responsibility, in my opinion, it is not the responsibility of the minority to lead diversity and inclusion. We have not been in these roles to create the systems and the organizations where there are no diversity or inclusivity. So the people that need to be in charge and heading D&I needs to be those that have created these systems. They need to be educated. And as a former student of yours in your health disparities class, they need to learn and take a lesson from that entire book and that entire class on how to lead and be inclusive of all. Let the implicit bias go. We do have them. How do we deal with it and how we implement it when we walk into an organization or a boardroom or a meeting or a Zoom call? There needs to be some education there.
Yeah.
So those are my 2 cents.
Thank you. And I agree. And I loved having you as a student, but I agree. I think education, as much as we can educate ourselves, right? It's not everyone else's responsibility to educate us. How much are we willing to educate ourselves? And we all have a ways to go, right? We all can improve in the education space, but right on. And I love the point that you just made about fixing systems that we didn't all create and we don't necessarily benefit from either. So it's a heavy load to carry to fix those systems. So I really appreciate that point that you made. Did anybody else have anything to add? Tiara, you were deep breathing. Have you finished taking those deep breaths?
Yeah, this is a tough question because I agree with you both wholeheartedly. And I also think it's important that the people who head those are deeply anti-racist, and that is not common. So I think the only issue I have with that is that we haven't gotten to a place enough in our society where most of the people who could be in those positions have the training, the understanding, and have done the deep inner work to know their roles in those systems enough to break them down. They're still trying to uplift these white supremacist systems, and we're trying to say they don't need to exist at all. So it's tough because I agree with you. It's not on us. We have to deal with the reckonings of it. We have to deal with the energy that comes after it. So it's not on us to change it. It is on them to change it. But they also need to be deeply anti-racist in order to do that.
Thank you. And I 100% agree. And it is definitely a paradigm shift, right? It's a paradigm shift, but you're right. We have to be honest about what that paradigm shift needs to look like in order for all of these committees, organizations, councils to be successful, right? Or it's more lip service. So I thank you for that. We have a question here. How can I, quote unquote, nicely educate the people who consistently say, I don't see color? I feel, okay, I'm going to take a breath now and put myself on mute while that happens, but.
How can I nicely educate the people who consistently say, I don't see color? There's a simple response. Have you been medically diagnosed as colorblind? If not, I need you and want you to not only see my color, but acknowledge it and respect it.
Right on, right on. Ashley or Tiara, did you want to add to that?
I wholeheartedly agree with Carletta, that she nailed it. That's all you can say. We need people to acknowledge, you know, who we are and our color. And so the goal is, we hear it all the time. The goal is for you. We don't want you to not see our color. We want you to acknowledge it and embrace it and understand, the hardships that we do currently face and have faced, and, you know, understand how you, as someone that's not of color, can overcome any implicit or explicit bias you have and work towards, being inclusive. That's all. That's what we're asking for. So we don't want you to not see our color.
Yeah, right on. And there's a narrative that's being pushed in many kind of segments these days, where the more we talk about these topics, the more divisive we are, right? We have all these race problems because we never stop talking about race. That's a narrative that we're hearing, right? And I think we would all agree that it's important to reject that narrative and point out that it is false. And when people say, I don't see color, if all you're seeing about me or any of us is our color, that is a problem, right? But you got to acknowledge the color piece, the ethnicity piece, the background piece, because that helps to make me who I am. It's not all I am, but it is a big piece of who I am. And it is a big piece of how I experience the world, right? And how I experience our society. And so you're not really interested in knowing me if you're not interested in knowing that piece, right? I think that's important. That's a nuanced conversation, and it's a tough one to have sometimes. I'm looking at the time. I feel like we can talk about this. We could just sit around and talk about this, and then take moments to deep breathe. But unfortunately, we're out of time. So before we kind of split for the night, I wanted to just pass on that this coming Friday, October 30th, right in time for Halloween, we would like to invite you to join the College of Health Solutions and the Metabolic Health Translational Team for an apocalyptic conversation with Athena at Actipes, an expert on zombification, apparently, Corey Wisner, and Matt Booman. Come dressed for the occasion, and a special prize will go to the best Halloween costume. You can find more about that event on the CHS online events calendar. 2 weeks from now, on Monday, November 9th, there's a special dialogue between our Barrett faculty fellow, Alex Trimble Young, as he connects with the author of The Two Faces of American Freedom, Aziz Rana, about race, patriotism, and the Constitution, and how they all relate and affect one another. And then on Tuesday, November 10th, please join the College of Health Solutions College Council as they host a town hall event with our Dean Hellitzer. And for more information on any and all of those events, please check out the CHS calendar and the Barrett events calendar. On behalf of everybody that was involved in putting this program together, our panelists, and especially myself, I want to thank the audience for joining us today. I want to thank the great guests for speaking today. And thank you so much for your honesty and your frankness. These are the conversations that we need to be having, not just in healthcare, but in our society. And I appreciate and thank you for taking the time to do so. Thank you and good night.